This is Heart Month, and so we are very much focused upon Heart Month and had so many folks in from IRMC to talk about it. We've got Dr. Rubin lined up. He's going to come visit with us. We have another doc that is going to come visit with us, but we're on the line this morning with the medical director for the UPMC Health Plan. She's Dr. Maria Guyette, who joins us this morning to talk about Heart Month and heart health. Our conversation is brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. Dr. Guyette, good morning.
Good morning. Thanks so much for having me.
It's wonderful that you're able to spend some time with us here today to talk about a topic that is obviously of interest in the month of February, being Heart Month, but it should be of interest to us all the time because cardiovascular disease, it's everywhere, and sometimes it's you find it in the most unlikely of places, don't you?
Most definitely. It is still the leading cause of death for both males and females in the U.S., and there's a lot more people than that living with heart disease in the United States. So definitely something that we need to be thinking about and talking about, and February as National Heart Month is a great time to do so.
You know, I'd like to start this morning with, you can start with prevention, you can start with any other topic, and it'll be germane, but I want to talk about CPR. Right now, with the Damar Hamlin situation, and with the idea that someone could drop over with a heart attack, and it doesn't matter what kind of condition they're in, but someone could have that heart distress and need CPR right away, and I don't think that enough people know how to do it. Do you?
Clearly, we don't. You're correct. So clearly, we don't all know how to do it. And we can see that when folks have bystander CPR and access to bystander CPR, which is what you're talking about, right? Anybody who is nearby is a bystander, then they do better. And Damar Hamlin is obviously a great example of that. And he actually is asking all of us to learn CPR. So if you go to the American Heart Association's webpage, you can see his request for all of us to learn CPR, which I think is a really important thing. I'm an emergency physician, and so CPR is really important to us to have the best chance at surviving a sudden cardiac death. We need CPR, and we need bystander CPR. I wanted to mention one more thing with CPR, because when we think of CPR, a lot of times folks talk about mouth-to-mouth resuscitation, and that can be a turnoff, right? People don't feel comfortable doing mouth-to-mouth with someone that they don't know if they're just a bystander. So we now teach both traditional CPR as well as hands-only CPR. So I want to bring forward the point that even if you're in a situation where you don't feel comfortable doing that breathing part of the CPR, if you can just do the hands-only part of the CPR, that helps too, and that's really important for everybody.
Yeah, absolutely. So where do people learn how to do CPR?
So if you go to www.heart.org, it's the American Heart Association, and they have lists of classes near you to be able to learn how to do CPR.
Yeah. Well, I wanted to get that right out there right off the bat because I think that's really important. So let's talk about heart disease and the primary risk factors for it. Who might be more likely to fall victim to heart disease than other aspects of society? First of all, women and Black Americans especially at risk, aren't they?
They are. So it's really important for us to be talking about this for those populations as well, to be thinking about, what are the things that I can change about my life in order to decrease my risk for heart disease. So there's some things we can't change. One of the things that we can't change is our genetics, right? If we have family members who have who have had heart disease, then we're at a higher risk of heart disease. And that part we can't change. But the things that we can change include our physical activity and our diet. So physical activity, it doesn't have to be running a marathon tomorrow. It doesn't even have to be running a 5K tomorrow. Just getting up and walking and moving your body is a way to get started towards getting physical activity as a part of your life and to decreasing your risk factor for heart disease.
We learn about heart attacks usually when someone around us has one, and we hear about stroke a lot, and they are obvious, very big indicators that there's a heart problem. But there are other conditions that have to do with heart health too, aren't there?
There are. So when we think about heart disease, we're thinking about cardiovascular disease, and the cardio part of that is the heart, right? And the vascular part of that is your blood vessels. So that's what those two pieces of that word are referring to. And your blood vessels, of course, go everywhere in your body. So they're important for getting your blood everywhere. And because of that, any system in your body can be affected by cardiovascular disease. Like stroke, that's when your brain's not, the blood vessels in your brain are not getting enough blood flow to your brain. The other two really big risk factors to think about are high blood pressure and diabetes. And it is possible that folks have high blood pressure and diabetes, but I don't want to think of those as a risk factor like genetics that we can't do anything about. Because we can do things about, and the same things that will help your cardiovascular disease, so moving your body, eating a good diet, quitting smoking, those are things that will help your high blood pressure and your diabetes as well, and also taking the medications that your doctor prescribes for you. And talking to your doctor, if those medications aren't making you feel great, it's okay to change those medications, but it's important to do that with your doctor's help and support. So it's important to come back to them and say, hey, this is not making me feel great. What else can I do? How can I change this so we can get you on the right medications to treat the high blood pressure and the diabetes?
Dr. Maria Guyette is with us, Medical Director for UPMC Health Plan, and it is National Heart Health Month. We want to pay a special attention to it. Dr. Maria, you said something a couple of moments ago that I wanted to go back to, and that is the idea of blood vessels and the overall heart as a muscle. You can actually have a heart attack and not do damage to the heart. Is that true? Am I saying that correctly?
You are. So you can have a heart attack and not do significant damage to the heart. Right, so a heart attack happens when we don't get enough blood flow to the heart. And how much damage occurs depends on a few things. One is how long that occurs. So that's why we encourage folks that if you're feeling the symptoms of a heart attack, like chest pain, you should get evaluated sooner rather than later. Because if you are having a heart attack, we can treat that, and when we treat it earlier, we prevent more damage happening. So the other thing that you can have a heart attack and not have significant damage is if it's just in a smaller part of your heart, right? So if it's just one vessel that's in a smaller part of your heart, it's possible for that to happen. Mm-hmm. But once you've had something like that happen, we know you're at risk for larger heart attacks. So if you've had a heart attack and we didn't get too much damage, that's great. But that's also a sign that we need to be thinking about the other things that we talked about as risk factors to address your high blood pressure and diabetes and start moving your body more and change your diet a bit to be able to decrease your risk for having a bigger heart attack in the future.
Couple of moments left with Dr. Maria Guyette. The medical technology is advancing so rapidly. And stent technology is just an amazing thing. And if you could, I'd like you to spend a little bit of time talking about the recovery process once you have that stent put in and how quickly you can get back to moving about and leading a healthy life.
Yeah, so that's a great question. So we're talking about the mechanics of it here, right? So we're talking about tubes. And when your blood vessel is a tube, when you put that stent in, it takes that tube, which has a clog in it and a block in it, and it opens it up. And it opens it up rapidly. And so that blood flow can get back through, which is wonderful. That's what we want to happen. And then after that happens, we want to support folks in getting back to the level that they were before, and sometimes to be being more physically fit than they were before as well. And so we often send folks to what we call cardiac rehab after they've had a heart attack, so that we can help them exercise in a space that we're able to monitor and able to say, okay, this is how far you can push. Maybe don't push it that far. Okay, we'll push it a little bit more the next time, in a controlled environment with support.
She is the medical director for UPMC Health Plan. She's Dr. Maria Guyette. Other resources, Dr. Maria, where should we go?
So if you search Check Your Heart UPMC, you will find everything you need to know about heart disease.
Beautiful, beautiful. Hey, thank you so much for spending some time with us today. It's been fun.
Thank you so much for having me.
Have a great day today.
You too.
It is the voice of Indiana County. It's WCCS 101.1 FM and AM 1160.